Okay, time to visit with Dr. Kevin Kavanaugh. Dr. K is a retired physician, also founder of a national organization, Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
Tell us about this big to-do that's coming up that you are sponsoring, your organization.
Well, this will be on September 14th. This is our 16th Health Watch USA conference, and we're going to have speakers from around the world and also from the United States talking about COVID-19 with an emphasis on frontline workers and healthcare worker safety. We have Dr. Dale Johnson, who's out of Singapore, and he heads up the WHO's Pandemic Response Advisory Group. We also have Dr. Lydia Maraska, who is from Australia, and she was named one of Time Magazine's 100 people who were most influential, and she's credited with really putting forward and pushing the WHO to accept and recognize aerosolization and aerosol transmission of SARS-CoV-2. And finally, we have Dr. Birx, who, as you know, was on the Trump task force. She will be talking about her experiences and how to try to prevent COVID-19 from spreading and mitigate infections in workers. And this is a very big topic, Jack. As you know, a lot of people have been just focused on deaths and hospitalizations, but we're seeing now more and more reports of long COVID. And so just getting infected is something that one wants to avoid.
That's cool. We'll continue to remind you of that between now and September and tell you how you can get in on that. I know that's going to be something that's going to be of interest to a lot of folks. I went on a little drive yesterday with a friend of mine, and we went up to Maysville, and so we had some time in the car, and we were discussing COVID, and my friend said, and he made a very good point, he said, I know we don't have the hospitalizations and the deaths that we had with COVID, but he said, I know a whole lot more people who have COVID or have gotten COVID in the last couple of months than I knew the whole time of the real serious wave of COVID. And it made me think that too. I mean, we've had people here at the station. I've had people that I know that have come down with COVID. So it seems like there are a lot of people with it. It's just not having, the horrible results that we got early on. Address that.
Well, yes, and that's after you catch the bug. Your chances of dying or being in the hospital are not as great as with the Delta variant. However, if you look at it from what are my chances of getting severely sick if I do a certain activity, with Omicron, they're probably greater. And the reason for that is it's a combination of infectivity and also the case fatality rate. And there's another study that has come out which really does show that in Massachusetts, they have excess deaths, which were greater with Omicron than with Delta. Again, the Omicron variant wave was a significant and severe wave.
You sent me some information. The first thing is that according to Reuters poll, 1 in 3 folks believe that the pandemic is over. It's not over?
No, it's not over. You can still get infected, and with infections come risks of Omicron. If you're vaccinated, the same is true. Now, vaccination with Omicron, but as you know, this vaccine was based upon the 2019 variant, and this virus has gone through a lot of mutations. You can still get infected. Some recent data is out. Even if you have a reduced chance of long COVID, some studies look at this as being around 50%, others only 15%. So long COVID is still a concern. So you want to still be careful. Right now, CDC is recommending wearing masks on indoor settings and wearing masks when traveling.
And one more thing before we have to go. CBS News immunology professor on why data shows more COVID infections among boosted Americans.
Yes, and that goes into the fact that once one is boosted, you tend to take more risky behavior. So again, it's not so much that the virus is more lethal or more prevalent in those that are boosted. In fact, they have lower hospitalizations and deaths, but because they're getting more exposure, they're getting more chances of being infected, and thus the cases are going up.
And always good to talk to you, Dr. Kevin Kavanaugh. Thank you, sir.
Thank you very much, Jack.